Good morning, everyone. This is Bill Miles, and welcome to the Chamber's 22nd weekly Tele-Town Hall. We have another great lineup for you this morning, delivering insight and information we can all use this week and beyond. This time has become the informative power hour, what's happening at the national, state, and local level that impacts all of us each day. I encourage you to continue to tune in each week to hear from prominent thought leaders. Next week, we're delighted to be hosting Suzanne Clark. Suzanne's the president of the U.S. Chamber of Commerce, and she'll be joining us to give us an insider's look at what's happening in Washington, around the country, as well as the world. And then the following week, we'll be honored to have Sid Evans. And Sid is the editor-in-chief of Southern Living, and he'll be joining us for that week's call. We'll also continue to bring you thought leaders and decision makers on the front lines of healthcare, education, our economy, tourism, and so much more. I also want to encourage you to mark your calendars to be part of an upcoming webinar on September 8th, just as students are heading back to school, which is appropriately titled The Balancing Act, Managing Family, School, and Work During COVID-19. We'll be hearing from the experts on ways to manage stress, which I think we all have plenty of, and as well as the uncertainty in a healthy way. So we'll be dealing with that stress and uncertainty in a very healthy way. The link is to register is in the chat box, and please take a look at that. And we hope you'll be able to join us on September the 8th for that. Also, as a reminder, please go ahead and start posting your questions for today's speakers in the chat box. We always enjoy having your questions, and the speakers are glad to certainly always answer those as well. To get things started this morning, we have an industry leader with us, and when it comes to balancing tourism and quality of life, his title says it all. He's the Vice President of Destination Stewardship with NextFactor, MMGY, which is a global leader in tourism research. Jim McCaul and the team from NextFactor have been conducting a number of focus groups and surveys on Hilton Head Island, and as we continue to chart our course for the next decade as a destination. We here at the Chamber are big believers in research-based strategic planning. And Jim is going to give us a sneak peek preview this morning at what we'll be discussing next Monday and Tuesday as we reconvene our groups to reveal results on the community research that we've done during the last 6 months. We commissioned the research because we feel strongly as an organization that it's critical to strike the right balance of our tourism economy and our residential quality of life. Here with us this morning to talk about community-based tourism in a COVID-19 world is Jim McCaul with NextFactor. Jim, welcome to the call this morning, and thank you so much for joining us.
Thanks, Bill, for having me. I'm just going to share my screen real quick. Yeah, I think Balancing Act, that's a perfect title for just about anything these days, because I think that's such a big part of trying to figure this out. You know, you're balancing a number of different needs. In this case, it's how do you balance the different needs of the community with also balancing the needs of the travel industry? And that's what we're going to talk through for just a few moments. So thanks for everybody for taking the time this morning to be with us. You know, the first question that I always get asked from people is, what does the recovery path and timeline look like? And I think the reality is, if I had a clear answer for that, I'd be a very rich man. But I don't, and I don't think anybody has a real understanding of exactly what a recovery path looks like. It's been said a number of times, but this is unprecedented. It's something we've never been through before. So there's a lot of building the plane while we fly it. And I think the reality is also that recovery for destinations is going to look very different. And we're already starting to see that. If you look at sort of what's happening now in the tourism space, urban destinations are really struggling. Occupancy levels at hotels are very low. Visitation levels are still very low. It's really a fight for survival in the urban areas. Whereas you look at some beach destinations, rural areas, national park destinations, they're actually doing, okay. And the comeback is coming back a lot quicker in those places because people are looking for places where they can escape crowds, where they can get to some outdoor spaces. Those are really sort of what's appealing for travelers these days. So it's a very unbalanced recovery, and it's going to be an unclear path where it's a lot of back and forth, where you start to see recovery take place, and then you see some pushback, and then you see some recovery take place and some pushback. And I think if you just look at this chart, it sort of showcases that. This is some data from a company called Destination Analysts, looking at sort of traveler expectations for recovery. And I think you see early on, not surprisingly, as things started to really ramp up, an increase in those who expected the outbreak to get much worse, a decrease in those who thought it was going to get better. I think you sort of see in late March, early April, people started to think, hey, things are getting better. We're going to get out of this. And that carried through for a few weeks, maybe in a couple of months, before you started to see a real uptick in, again, people thinking, okay, this is getting much worse again, and a big decrease in those who think it's getting much better. I think the reality is, just as we go through this, there's going to be a lot of this up and down. You're going to see things start to pick up again, and then you're going to see some small outbreaks and things having to close back. Everybody talks about, it's not turning a light switch on and off; it's really a dimmer. So it's how do you reopen in a phased, nimble approach that can be reversed quickly, and I think that's what we're starting to see in a lot of places. If I think about what recovery actually looks like from a timeline perspective, I think the best guess that I've seen from anybody is from a company called Tourism Economics that we work with. This is sort of their timeline for recovery. In summer 2020, that's when you start to see really the domestic leisure drive market lead things. And that's definitely what we're seeing now. The drive market is really where the business is. Some domestic leisure fly markets starting to pick up, but really all domestic travel at this point in time, and very regional focus. People are really looking to stick within their own communities where they feel safe, which is understandable. The second phase, possibly beginning fall, and again, this isn't when things are really ramping up. This is just when things are starting. You'll start to see some essential meetings take place. People are starting to feel a bit more comfortable being part of a meeting. I was just part of a hybrid meeting yesterday, and I think people are getting a lot more comfortable with that, how you do a mix of meetings in person and virtually. Again, it's small, medium events, and it's sort of that regional, international that starts to pick up. So maybe, the U.S.-Canada border opens up at some point, and you start to see travel between those places. You've seen this idea of sort of destinations creating these travel bubbles, and it's people who are destinations who are in the same area saying, okay, we're all handling this at the same pace and we're all comfortable with where we're at. Let's create a travel bubble so that we can travel amongst each other, but not sort of expanding our reach outside of that, places we don't feel safe. And then finally, not till next year do you start to see sort of those large events and long haul international trips start to come back. And again, this is just when things are picking back up. The reality is, if you ask Adam Sachs at Tourism Economics when he thinks travel will return to pre-COVID levels 2019, it's not until 2023, 2024. So while we do expect things to sort of revamp and pick up quickly, we're not going to get back to where we were from a travel industry perspective for a number of years. And I think this sort of just says a lot. If you look at, this is a survey done by Destination Analysts just like a week ago, and they asked, folks, how much do you agree with the following statement? I'm planning to avoid all travel until the coronavirus situation blows over. Still more than half, almost 60% of Americans are saying, I'm not traveling until I feel like this crisis is over, which is a really interesting question because it's tough to define what the crisis being over actually means. Is that when we get a vaccine? Even if we have a vaccine, distribution is going to be a challenge. So how do you define a date when you can actually say that COVID-19 crisis is over? And if over half of Americans are saying, I'm going to hold off all travel until then, it just gives you a sense of sort of what the recovery from a timeline perspective is going to be. That it is going to be slow to get back to those 2019 levels, as I said before. The other side of this is you have communities rightfully saying, I feel uncomfortable with large amounts of visitors coming to my destination. Again, same survey from Destination Analysts, with over 50% of Americans saying, I don't really want visitors in my community yet. And only 15% of folks saying that they do. And I think this sort of goes back to that idea of travel bubbles and who do we feel safe with coming? Maybe we don't feel like we want those long haul international folks coming to the destination quite yet because there's not those sort of understanding and the same sort of recovery timelines. But maybe we do feel comfortable with folks down the road just getting out and about in our own communities. And I think a big part of this is the reality is that most travelers and residents are looking for the same things. We asked about sort of lifestyle priorities for travelers. The number one priority is staying safe from infection, which is, it's the same thing that the community members are looking for. Everybody wants to stay safe. That's the top priority for travelers and communities right now. So I think it's good to see that those are aligned. Just behind that, finding joy and happiness, emotional well-being, relaxation, those are exactly the types of things that people who are traveling to Hilton Head are looking for. But I think it's important for people to know that the travelers are looking for that same thing in terms of staying safe. So there is an opportunity and a possibility to have, visitors in your community without having, the issues that could possibly come along with that. And again, if you look at just sort of what those who are interested in traveling right now are telling us, is that they definitely plan to practice safe travel etiquette. The vast majority of travelers saying that they plan to wear a mask, that they follow social distancing guidelines, that they're avoiding crowds. These are people, again, as I said before, nobody's looking to go to urban downtown core areas right now. They're traveling because they want to escape crowds. So, they're doing they're traveling in a responsible way, and they're traveling again with that top priority of avoiding the pandemic and avoiding any possible risk to being sick. So when we look at sort of the key elements of what a recovery plan looks like for any destination, I think the critical thing is, as Bill talked about at the beginning of this, it's community-based recovery. So we talk about three different elements. One, community building, and that's the idea that sort of the residents of the customer. It's how do you align public and private sector, community vision to have sort of this shared vision for the future of what your community looks like from an industry perspective, so that locals and business owners are all benefiting from tourism. It's not tourism for the tourism industry's sake, it's tourism for the betterment of all in the community. So how do we build out a vision and a plan that achieves that? The second is customer engagement, and that's really this idea of residents of the story, and that the community is the brand. We talk a lot about the travel industry over the last decade, maybe even more, has become more and more commoditized, more and more globalized. So for destinations to really stand out in this environment, it's becoming more and more challenging. There's a number of destinations in the world that have great beaches, great golf courses, great amenities, great restaurants. So how does a place like Hilton Head really stand out? And it really is that community. It's the values of the community. It's sort of the cultural DNA of Hilton Head. It really defines what the destination is. And that's going to be sort of the brand that really pushes people to say, I want to become a part of this. So that's sort of what we see from a customer engagement side. And then lastly, from an organizational sustainability side, the reality is tourism organizations in this environment are struggling right now because hotel occupancy, taxes are down right now, budgets are down. And they're looking at new roles and new KPIs around equitable growth, quality of life, inclusivity, sustainability, all the things that Bill talked about at the beginning. These are sort of becoming the new milestones for destinations. Thinking about how do we achieve that balance of supporting the industry, but as we've said before, making sure that tourism is a benefit for all in our community. And what was fantastic to see is we did a workshop with Bill and his team and some community stakeholders just a couple of weeks ago, and asked them about, what do you think of the priorities for Hilton Head coming out of this crisis? What does community-based recovery for Hilton Head look like? And from a community building standpoint, what was great to see is the sort of top priorities that the group came up with was working with industry partners and stakeholders to reopen the visitor economy with clean and safe visitor experiences, which is fantastic to see from a number of standpoints. One, as we said before, that's what travelers are looking for right now. They're looking for places where they can experience those clean, healthy, safe attractions, experiences. It also means that we're trying to reopen in a way that aligns with keeping the community safe, which is good to see. As I said before, there's a number of residents who are rightfully worried about having too many visitors who are coming and acting irresponsibly. So if we're working hard to open things up in a clean and safe way and translate that over to visitors, again, it's going to be an opportunity to bring people back in a way that is safe for everyone. And then second, working with relevant and targeted stakeholders to address social sustainability. So amplifying community pride through all this, supporting those less advantaged communities that have been dramatically affected by COVID-19, supporting areas like the arts and creative economy who have also been hit hard. If you look at just a great example of this initiative is Hilton Head's Promise. It's really an opportunity to take that lead and showcase sort of the safe and the healthy experiences that are available there. It's setting standards for what it looks like to operate in this new environment. And then, as I said before, it's communicating that to visitors so that they know, one, here's what I expect to have when I come to Hilton Head. Here's the sort of types of experiences that are going to be available to me. They are clean and safe and healthy experiences. But also lets them know we expect you to act a certain way when you get here. We expect you to mask up. We expect you to wear that mask when you're here because you are a visitor in our community. And we expect you to be respectful for the residents who are here and make sure that you are keeping their needs and their desires firsthand. And I think just a fun example of sort of what this looks like is what they're doing in Montana, really promoting this idea of being responsible while you're in their community, but doing it in a way that ties into that sort of cultural DNA of Montana that I talked about before. So, very outdoorsy, fishing is a big part of life there. So just saying like, hey, look, we wear masks all the time. It's part of our lifestyle. We expect you to do it while you're here visiting us in the near future. From a customer engagement side, what was interesting is that the folks in Hilton Head told us that developing messaging to reinforce the community's values in this new normal is going to be their top priority. And I think for us, that's really satisfying to see, because the reality is that this idea of values-based tourism is something that was taking place pre-COVID, and it's one of the reasons that we began working with Bill and his team. As I said before, it's really those values that sort of make a destination stand out. And there's been a lot of talk in the industry recently about, what types of travelers do we want to attract? Is it a high value traveler? Is it somebody who's going to come and spend, more money here? What exactly is the way to have the greatest impact in Hilton Head from the different traveler segments? And I think what's really interesting to see is more and more destinations like Hilton Head saying, our ideal traveler is somebody whose values align with the community's values. So if Hilton Head prioritizes, preserving the natural environment, health and wellness, all these different things that sort of make up the Hilton Head values, we want to go after the same types of people who share those values. We want to build products and experiences that the people of Hilton Head, the community, really value, and target travelers who share those values. And when you do that, you build a much more homogenized tourism experience. You create an experience where, because visitors and residents share the same values, there's less of a dichotomy between, this quote unquote tourists in the community. Now all of a sudden it's more of a welcoming guest in to share the same types of experiences that you're looking for. They value the same things as the community. So you have less of a experience where, visitors are doing things that the residents are less happy with. And I think it's fantastic to see Hilton Head really pushing that forward in the future. And then lastly, is just sort of looking at, what does success look like for the organization if this is the case, and changing some of the success metrics around community and advocacy. It's looking at things like measuring resident satisfaction to make sure that our community is happy with the way that tourism is being developed and promoted in their area. Looking at things like inclusivity and equality to make sure that, again, as we look at sort of the impact of travel, that it's being done in a way that benefits all in our community. I think all too often we see, there's a small percentage of folks in the community who are benefiting from travel, and the rest of them are the rest of the community is paying the cost. And I think what we're talking about here is, how do we bring back travel? How do we do it in a way that balances, as Bill talked about from the very beginning, balances, the needs of the industry? And the reality is the needs of the industry are very strong right now. If you look at just unemployment numbers, the hospitality and tourism industry has been hit harder than anybody else. The reality is hospitality and tourism is in a depression while the rest of the economy is in a recession. The vast majority of jobs that have been lost are in that hospitality industry. So it is critical that we rebuild that industry and bring those jobs back as quick as possible, because we're talking about people's livelihoods. But we want to do it in a way that is, thinking about, not just those who work in the industry, but how do we bring back tourism in a way that is beneficial for everybody who lives here. And I think that's sort of the mission that we're working on. That's the mindset that Bill and his team have. And I think the really interesting and really fun thing is, I think this is going to be a strategy that separates Hilton Head from the pack coming out of this crisis, because I think it's going to be these sort of communities who are really focused on, locals, local hood, sharing local ideas and experiences and values that are going to stand out in the future. If people are just focused on, saying I've got these products, it's not gonna work in a post-COVID world. And I think what's fun to see is I think Hilton Head is really positioned to come out of this strongly, and I'm excited about the future of working with Bill and his team. And that's all I have for today. So thank you so much.
Jim, thank you very much for your presentation. And as a reminder to everyone, on Monday and Tuesday of this coming week, we will be continuing that conversation of a shared vision for the future. And we would encourage you to, if you're listening today, to join in and be a part of that, to hear some of the reports and discussions that Jim and his team have done over the last 6 months for the destination. Jim, if you got time, we've got just a couple questions here that I'd like to ask you. Our first one comes this morning from Bob, and Bob is asking, how much does pricing influence visitor decisions to come to the island? And then secondly, are visitors looking for better deals as justification for traveling during the pandemic?
Yeah, it's a great question. I think pricing is definitely a critical component of what's taking place right now. If you look at the folks who are willing to travel at this point in time, discounts are definitely something that is motivating to them. I think that the bigger thing, though, that we've seen from people is they are looking at, making sure whatever they purchase is refundable, because, we talked about from the very beginning that sort of uncertainty. If I'm booking a trip, even next week, I'm not 100% sure that I'm going to be able to make that trip. So while a discount is fantastic, those sort of refund policies are being rewritten by just about every tourism organization, because consumers are very weary about, booking something in such an uncertain future. And then the other thing just that the industry is sort of focused on is discounts can be great to sort of motivate people to travel during this time, but there is a risk to heavily discounting, because eventually you have to build your way back out of that. And that sort of rebound from discounting can sometimes take longer than the discount was actually worth. So that discount to stimulate a small amount of travel right now, building your price point back up over time, you have to sort of consider the cost and benefits of sort of discounting at this period.
Thank you for that answer. And Jim, another question for you. Knowing that fall and winter will be a challenge with meetings and groups, what are some of the best practices post-quarantine to secure that business in our new reality? And that comes to us from Frank this morning.
Yeah, it's a great question. What I have seen so far in my experience with the industry is there's a gap between sort of meeting planners and suppliers at this point in time. Suppliers are still trying to figure out, how can I help planners get more people back to my destination? So, if I look at meetings pre-COVID, it was about, if I was part of an association, how can I get the most members from my association to a meeting in Hilton Head? Meeting planners are no longer concerned about that. They're not trying to get as many of their members to a place at this time, because the reality is that they, one, just can't do it, and their members don't want that. So they are looking for those sort of new technologies and new opportunities to do hybrid meetings, as I talked about before. How can you do a small in-person meeting that is then broadcast to a larger audience? They are looking for venues and destinations to really step up in terms of health and safety measures. I know some hoteliers, some destinations who have a medical professional who's sort of a contracted staff member now to help walk through what sort of meeting planning guidelines would look like in this environment. But I really do, I think it's that sort of understanding what planners are looking for right now, and they're looking at how can I deliver the greatest value to my membership right now, or my company, whoever that is. And virtual meetings can only deliver so much at this point. So, I was part of a hybrid meeting yesterday in San Antonio, and it was actually a pretty good experience. The room was mic'd. I could hear everybody there, the people in the room. We had great communication. So I think it is sort of, that technology aspect that was lagging in the past is really being pushed forward now. I do think as we're allowed to meet in larger groups, what's going to be interesting is, can you do a 1,000-person meeting in a destination, but not all in the same space? So could you do 4 hotels in a destination with 300 people in each of those rooms, rather than sort of a citywide meeting at a convention? I think those are the types of conversations that people are trying to have right now.
Jim, thank you. We're going to let you go this morning. We look forward to working with you and your colleagues again next week. And thanks so much for the very informative discussion this morning.
Thanks for having me.
Have a great rest of your day. To take a look at the statewide level today, we're pleased to have back with us the Director of South Carolina Parks, Recreation, and Tourism, and our good friend, Dwayne Parrish. Dwayne, good morning.
Good morning, Bill, and thank you. Glad to be back with you once again. I'll sort of update you on where we've come from since my last time on the call and what's going on now. So the number of hotels is at 21, which is pretty much what I reported last time. Those that are closed are primarily closed for renovations or reasons other than the virus itself. That number seems to have stabilized, and I don't anticipate it to change too much. There are a couple of hotels around the state that do close for 2 days a week, one for 1 day a week, one for 2 days a week, that do deep cleaning during those times. But for the most part, when people ask about our hotels, I say we're pretty much fully open. So occupancy on the hotel side for the week, I'm going to go back and give you the most recent 2 weeks that I have data on. The week ending July 25th, the United States ran 48.1%, the Southeast ran 48%, and South Carolina ran 52%. Leading the pack was Beaufort County, which obviously includes Hilton Head as well as the town of Beaufort, at 70.4%, significantly above the norm for everyone else. And a little bit of what Jim said about beaches being very attractive, coastal destinations, if you will. And then occupancy for the week ending August 1st, the U.S. was at 49%, Southeast at 48%, and South Carolina at 53%. Once again, Beaufort County led the way at 67% occupancy. This sort of trend for us as a state, we've had 14 consecutive weeks now that our occupancy, hotel occupancy, has been higher than the rest of the country and the Southeast. About 5 weeks ago, we were on about a 9 to 10 week climb, and about 5 weeks ago, we took a dip down when all the national and regional publicity about sort of the larger fast increases in the number of cases sort of hurt us, and we dropped from a high of 58% back to 48%. And then the last 3 weeks, we sort of climbed our way back to 53%. But a couple of key points on it and some data I've seen, and to reiterate what Jim said, downtowns are out of favor now. And honestly, one of the best things about Hilton Head and Myrtle Beach is they don't have a sort of designated downtown. The peninsula of Charleston is considered downtown. It is a peninsula, which sounds to the public like, okay, small, crowded. That's where most of the protests have happened in downtown areas. It's where people see a lot of crowds on the press, particularly on the national press. So I've looked at the occupancy of, say, downtown Charleston, and it's the worst it's ever been. Downtown Atlanta, same thing. The large metropolitan downtown, and even small to a degree or mid-size, are struggling compared to rural areas that offer a water feature like lakes, rivers, and particularly the beach, as Jim talked about. And that certainly seems to be the case. I thought I'd share, Jim shared some of the travel sentiments. I won't go into all of Longwoods, but pretty much reiterating what he said. But a couple of things that I thought I would point out. They did have in their most recent data, and this is from, from yesterday, is the volume of those reducing trip plans has once again exceeded the volume of those canceling plans. And by that, I mean there's more people who are willing to change their plan, either make it shorter, as in destination, or shorter length. Shorter length of travel is now better than, or exceeded the number of those just pure out canceling. A little bit different number than Jim had. Jim's percentage was lower, but in the Longwoods poll, it does show 68% of traveling Americans still say they plan to travel in the next 6 months. Now, that travel may be shorter. It may be both in distance and in length, but nonetheless willing to make some sort of travel. Excuse me. Along those lines, we've still continued our marketing. We're ready when you're ready. You can see my background. That's one of our print ads. Actually turns into a video as well that we sort of run out there as well. That sort of mirrors some of your advertising, as well as what you do in regard to your local certification programs that you're doing in Hilton Head that businesses have signed up for. A couple of other things going on around. The governor, a week and a half ago, issued those mandates about restaurants. Essentially, what happened from Accelerate SC's recommendations for restaurants became mandates. Some of the key ones in there were keeping restaurant patrons at least 6 feet apart in terms of seating. It was restaurant employees and staff had to wear masks, and indoor could not be above 50% of the fire marshal capacity. Those are sort of the key ones that came out of there. It's a tough time. This is the worst time ever, and the restaurant industry is probably feeling this impact more than any other industry, certainly in hospitality, more so, even as much or more than hotels. Difficult time, but those good operators have been smart all along. Have had their staff in masks, have figured out how to do more outdoor seating, which certainly people seem to be much more comfortable with, and that seems to be across the state what I see more of. But there are many restaurants, as you're well aware, that won't make it through this, particularly as it becomes an extended period of time. And it seems to be many will reinvent themselves, some will close, some will reopen as something else, but a difficult time for restaurants nonetheless. Also, the governor issued an executive order about gatherings, limiting them to 250 people. Now, there are exceptions to that, and exceptions can be applied for on South Carolina Commerce's website, which is sccommerce.com. It is on the home page there. As you can imagine, there are a lot of things, while college sports may indeed be on the brink, but sort of a lot of things going in a very fluid situation right now. We have done some blanket approvals for USC and Clemson, at least the process is underway, so that they can have fall sports and not have to come back to the state for every single event. Obviously, even if a football game is held and there are no spectators, there are still more than 250 people in the facility. So doing some of those things, we've already done USC and Clemson, working on the balance of the universities and schools around the state. Same thing with the South Carolina High School League, as well as the Independent League for high schools, to try to get them some sort of blanket coverage so that they're not dealing with this on a weekly basis. But this also applies to weddings, as you can imagine, amateur sports, American Legion Baseball, recreational softball and the like, trying to get some of those where appropriate, and to make sure that people are doing the right things. There's an opportunity on the website. Not only do you answer a lot of questions, but there's also an opportunity to upload your seating chart or some of your protocols that may be in place as well. So you sort of look for that if you have an interest or going to a group, or if you're attending something where there's a gathering more than 250 people, and you want to know what they've said their protocols are, you can see what some of the questions are on there, and we'll know at least those things if they've been approved. State parks continue to be busy. As I mentioned before, May reopened May 1st. It was a record month. June exceeded May, and yes, July has exceeded June. This is despite Hunting Island being closed for a few weeks because of flooding. Our camping for the month of July was up 23%. Cabin occupancy was up 11%. Again, this goes to what Jim was saying, and I've said before, is that people looking for outdoor space, if you will, acreage, square footage, whatever the case may be, and not being around crowds per se. I know at a time when hotels are struggling, campgrounds nationally and state parks across the country, as well as national parks, are very busy. Lastly, on a couple very positive notes, Bill, I want to say congratulations once again. Hilton Head's the #3 island in the U.S. by Travel and Leisure Magazine. A tremendous award. Makes South Carolina proud. It's always good to see those ratings for destinations in our state. And then I'll finish with golf. So I've got the state numbers for golf for the month of June. Rounds were up 15% in golf. Golf had not necessarily enjoyed some of the fruits of the last 7-8 years of economic success in tourism. But certainly during this time in the pandemic, for the most part, at least in South Carolina, we've done very well with golf. Golf offers an opportunity to social distance and be outside. And certainly that hopefully seems to be the case. And I anticipate July numbers being very strong too. And if the weather holds up, I hope that continues all through the fall. So Bill, pending any questions, that concludes my report.
Thank you, Duane. Question for you from David this morning. And he's asking, what are you hearing or other destinations starting to hear from groups for later in 2021?
Hearing from groups, I'm sorry, repeat the last part for me, Bill. I'm sorry.
Yes. So what are your destinations starting to hear from groups as far as group business for later in 2021? Is it the future optimistic in mid 2021?
Yes, I am, for a couple of reasons. One, a lot of groups were booked either in this late spring, summer, and it's happening right now for the ones in the fall. Over half of them are being rebooked. In other words, they've just postponed it, if you will, instead of canceled. That, if you sort of align that with normal meetings that would take place, 2021, obviously the vaccine plays a tremendous part in this, but 2021 for the meetings market could be a very good year. Because you had postponement, it's sort of like pent-up demand of leisure travel. Well, there's pent-up demand on the meeting side too. And while I agree with Jim, technology's come a long way in meetings, it will never replace the face-to-face meeting. And so I think people are, particularly those who attend a lot of conferences and travel to meetings, are really looking forward to going out. I went to one of my first ones a couple of weeks ago in West Virginia, and it was just a great feeling just to see some people in person. So I think 2021, pending a vaccine, even if the vaccine has not been implemented across the country widely, I think the psychological impact of having a vaccine will allow a lot more meetings to take place in 2021. I know a lot of the conferences, both in in the travel industry, but also in meetings in general, has been shifted to 2021. Hope that helps answer the question.
That does. Thank you, Duane. One more question for you from Linda. And Linda is asking when the governor's executive order will run out, which affects restaurants.
Right now, it's indefinite, but that doesn't mean it goes. I mean, a lot of things will play into that. Case numbers are being watched. The really, really good news, the case numbers have gone from, we were running on through about a week average of close to 2,000. And we came down in a week average recently about 1,200. And in the last 2 days have been below 1,000. And so we've certainly been trending the right direction. I think there is a lot of a hard watch going on with schools coming back in, particularly college and universities, with cases potentially spiking up. That obviously would not help reopen the other 50% of restaurants and other things in place. But certainly DHEC is monitoring that on a really on a daily basis in regard to the number of cases. But I don't anticipate the restrictions on restaurants being lifted very soon unless the case numbers continue to come down. And we're all hoping for that, obviously.
Right. Thank you for that, Duane. Duane had mentioned also what the state occupancy numbers were, as well as Beaufort County occupancy. I just want to relay to to all of our listeners that from July 26 to August 1 for Hilton Head specific, we were running at 71.6 hotel occupancy. And while that sounds like a decent number, and we're delighted to be leading the pack, I think it's also important for everyone to know that that is down 17.8% from last year. And then as we look into the week of August 14th through the 20th, just to continue to put things into perspective, the advanced reservations are running right now about 60%. And last year they would have been running about 78%. And so when you look at number of guests on the island, at those numbers, we'll be seeing from the hotel standpoint about 38,000 guests this coming week staying at hotels, which is down about 11,000 from the previous year. So Duane, it's always a pleasure to talk to you. I like the way the ad looks. It looks beautiful. And thanks for joining us today.
Thank you, Bill.
All right, I want to mention one other thing. In the beginning this morning, I talked about the webinar that we're doing, the Balancing Act, Managing Family, School, and Work during COVID-19. And I mentioned I provided the wrong date on that, and I apologize. If you go to the chat box, the registration has the right date on that, and that date is August the 19th. So please sign up and register for that, and our own Hannah Horn will be hosting that webinar along with some other very, very good speakers as well. Moving along today, our next speaker, he's at the helm of an organization who's proudly celebrating its 45th anniversary this month. And we're certainly fortunate to have outstanding medical care in our community. And under the leadership of CEO Jeremy Clark and his team of healthcare professionals have certainly set the bar for healthcare in our community. Jeremy, welcome this morning. Glad to have you.
Great. Thank you, Bill. It's exciting to be back, and I appreciate the kind words to lead off. Always good to be on this call. To start off this morning, like I usually do, I'll give everyone an overview of what we're seeing in the hospitals and throughout our community. Currently, Hilton Head Hospital and Coastal Carolina Hospital have a total of 9 COVID positive patients in our hospitals, with one of these being in the ICU. This is a decline from what we were seeing last week and a decline from what I reported on this call 2 weeks ago. So we're starting to see a little bit of a decline in hospitalizations. We still have ample capacity in both our critical care beds and our medical beds as well. So we're not seeing that surge of COVID patients at this point, but I always want to remind everyone that if we do see it, we're ready. We have very well-developed plans that we started working on 5 months ago now and have been rehearsing, but we have very well-developed plans to repurpose our staff, our beds, our ventilators, should we need to. We also have a good stock of personal protective equipment. We have access to the drugs and the treatment protocols that we need to take care of COVID patients. My team and I are regularly assessing the situation both in our local community, but also in our hospitals to see if we need to do anything, if we need to change anything that we're doing. So as our local situation changes, we'll implement the plans that we know that we have to deliver safe, high quality care. But I also want you to know that we're not letting our guard down, and neither should anyone on this call. This remains a very serious disease, and I ask that everyone please remain vigilant, continue to wear a mask, continue to wash your hands, continue to keep your distance from others. Outside of our hospitals, we are continuing to offer testing in the community. Last week, we performed over 700 tests, mostly in our outpatient drive-through testing centers located on the campus of each hospital. At these centers, any patient with a physician order for a test can show up every weekday morning without an appointment, get tested at no cost to them. Additionally, we continue to work with partners in our community to host community testing events. These events are free. No physician order is required for these. And in the last week, we've conducted 2, one on Hilton Head Island and one on Defusky Island. At the Hilton Head Island event, we tested over 400 individuals, and at the Defusky event yesterday, we tested over 200. So these are in addition to the 700 individuals we tested in our outpatient testing on the campuses of our hospitals. Our next week we have our next one. It's Wednesday the 19th at Bluffton High School. It will take place from 7 a.m. to 11 a.m. Again, no cost to patients, does not require a physician order or an appointment. And again, we're very fortunate to have great partners in the community to help us pull off these events and offer this testing to the community. At these events, we continue to see more patients testing positive. The vast majority are local residents. These are not very few are from out of town. Thus far, most are having symptoms that do not require hospitalization. But while we are continue to see new cases in the community, we are starting to see the positivity rate flatten. The positivity rate is the percentage of patients that test positive. So we're starting to see that flatten after rising from early June into mid-July. And additionally, we're starting to see the average age of positive patients stabilize, again, after it was getting older from our early June to mid-July. So while we're not seeing a surge of COVID positive patients in our hospitals, it's always good to remember the vast majority of our patients we're not treating them for COVID-19. They did not have COVID-19. Patients continue to choose us for emergency care, continuing to choose us for elective surgery. And we're able to provide that high quality, safe care for them because we've created a safe environment inside of our hospitals. So to wrap up, I just want you to know that our hospitals remain ready. We've created a safe environment to deliver care. And while we are treating COVID positive patients, the vast majority of patients that we're taking care of we are not treating for COVID-19. We'll remain ready. If we see a surge, we are ready. We have good plans. We have good plans and great people to take care of folks. So appreciate the leadership from our state and local officials. Appreciate everyone's support for our caregivers. And just want to close by reminding everyone to wash your hands, wear a mask, and keep your distance. And Bill, I'll turn it back over to you.
Jeremy, thanks so much. And that's encouraging to hear over the last several weeks how the hospitalization numbers have gone down for a total number of 9 at Coastal and combined with Hilton Head Hospital for this week. And thank you. We'll continue to celebrate the 45th anniversary and keep up the good work.
Great. Thanks a lot, Bill.
All right. Thank you. Our next speaker this morning, we're going to move to Dr. Michael Kacka, and Dr. Kacka is with DHEC. Dr. Kacka, thank you for being on again today.
Can you hear me?
There you are. Yes. Thank you. Good morning.
Oh, perfect. Thank you. Good to be on the call again. So as always, I'll give a little update on the numbers here. So for the past week for the state of South Carolina, we're reporting 7,756 confirmed cases and 184 new probable cases for the week. That brings the total number of people with the disease in the state to 101,360 confirmed cases and 770 probable cases. So for Beaufort County for the past week, this includes 452 new confirmed cases and no new probable cases in the last week. Totals there for the county are 4,184 confirmed cases and 10 probable cases. For the Hilton Head zip codes 29926 and 29928, 58 new cases were reported for a total of 737 cases. And for the Bluffton zip codes 29909 and 29910, 91 new cases were reported for a total of 1,255 cases. So the state of South Carolina, Hilton Head, Bluffton, and Beaufort County all have seen decreases in their weekly case counts for the second straight week. So continuing to trend in the right direction there. So for Beaufort County, the 450 new cases that were reported were lower than the 552 from the week prior. So from 552 cases to 452 cases. For Hilton Head, it went from 61 cases in the prior week to 58 cases in the past week. And then for Bluffton, those numbers are 121 in the previous week to 91 cases in the past week here. So all going down. Unfortunately, we're also reporting 238 additional confirmed COVID-19 related deaths in the state and 13 probable deaths. It brings the total number of people confirmed to have passed away from the virus to 2012. There's also been 86 probable deaths related to COVID-19. 8 additional confirmed deaths were reported in Beaufort County individuals, and the total there is at 55. Probable deaths in Beaufort County is now at 2. I had previously reported this number as 3. This means that after investigation of one of the cases, it was found that their primary county of residence was not Beaufort County. They were probably a resident of another county or another state. That's why the number goes down there from 3 to 2 probable cases. So new death reports in the state decreased last week compared to the previous week, from 269 cases in the week to 238 cases. This is the second straight week of decreases in weekly death totals for the state. Confirmed deaths in Beaufort County went down from 13 deaths in a week to 8 deaths in the past week. So overall trending in the right direction. Unfortunately, the state of South Carolina did pass 2 grim milestones in the past week. We now have over 100,000 confirmed cases of COVID-19 in the state and over 2,000 confirmed deaths related to COVID-19. But as I've said, we are trending in the right direction at both the state level, Beaufort County level, Hilton Head, and Bluffton. Deaths from COVID-19 are also trending down in the state and in Beaufort County as a whole as well. And this is happening because people are doing their part to prevent the spread of the virus. Each of these individual choices that are made to maintain social distancing and wear a mask, each of these add up to a reduction in case numbers and lives saved overall. So as I'll echo what Jeremy said before me, to continue to stay vigilant and take those steps, because we know that they do work, and they are working now to kind of bring these case numbers down and to prevent new deaths. So, and as I teased the last couple weeks, it was a little bit delayed, but the county level data dashboard is now available on our website. And I think that's going to be a very good resource for people to get more information specifically about what's happening at the county level. So to find it, you do go to our main landing page, the scdhec.gov/COVID-19. And if you go there, you scroll down a little bit to the blue summary screen that has some of the case numbers and a lot of other data there. There's a green button that says South Carolina county level data for COVID-19. You can click on that, and I encourage everyone not only to check that out to see what's available there, but there's also a little survey there that you can fill out if you have some feedback on ways that presentation can be improved. So, and while you're there, there's lots of good information on our website about COVID-19, informational stuff, additional data as well that may be helpful to people. So for people to check that out, and I'm happy to take any questions.
Dr. Kacka, thank you for the encouraging and somewhat optimistic news, and glad to hear that our numbers are starting to trend a little bit better now. A question comes to us this morning from Michael, and Michael is asking, when will we be able to get COVID test results the same day?
So there are some rapid tests that are becoming available. There's several. There's ones that test for the antigen, which is the protein on the virus. There's a lot of nursing homes that are going to be receiving those. Those tests are on the market right now. They're not as widely available. They're still in the process of producing those. So I don't know exactly what the status of the manufacturing is and kind of getting those out into the communities. I think when we are able to get them, they're going to be very helpful. There's always a cost associated with getting a quicker test. You may have more false negatives. You may miss some cases that are actually there, but the benefit of having that faster information actually kind of makes up for that. So unfortunately, I don't have a timeline for when we're going to have those out in the community, but I think it's going to be very helpful when we are able to have those and have those kind of same day, within an hour or so test results.
Dr. Kacka, thank you for being with us again this morning. We look forward to another update from you soon. And also for our listeners, we have just posted in the chat box the website that Dr. Kacka was referring to. Dr. Kacka, thank you again, and we'll look forward to hopefully talking with you next week.
All right, thank you.
Thank you. All right, our next speaker this morning is Fred Green, and Fred's a good friend and president of the South Carolina Bankers Association. And Fred, we know that the PPP program was sunset at midnight last Friday, and just be interested to hear your take on the program and things that the numbers of what South Carolina bankers did with the program.
Well, Bill, good morning, and thank you again for including me on your membership call. I was thinking earlier this morning that you and I have known each other for over 30 years, and these calls that you have helped facilitate, just another good example of the tremendous asset you are for your membership as well as the region you represent. I've, as you mentioned just a little while ago, been a regular participant on these calls since early April, and in additional learning from the other participants, it's also allowed me to reconnect with some old friends from Hilton Head from the time that I was there. So thank you again. As you mentioned, PPP program has ended. So let me wrap it up and kind of give everybody a little update on where we are. The first PPP application was submitted to SBA on April 3rd at 12:01 a.m. and the program had a sunset of 12/01 this past Saturday. So I want to give a quick recap and maybe tie a bow on what the South Carolina bankers were able to accomplish for their small business customers. During this 4-month period, South Carolina banks helped over 63,000 South Carolina small businesses by closing around $5.7 billion in PPP loans. Now that's extremely impressive to accomplish so much under a very short period of time. But I think the most impressive, at least to me, is that these loans help protect over 650,000 South Carolina jobs, which represents over 25% of the entire workforce of our state. I'm very proud of our bankers, and I'm also proud to be a banker myself. Our industry really stepped up and in a lot of ways became the first responders for our economy. So what's next? The forgiveness rules and forms are available. There was additional information that was distributed just this morning, but the process, the forms are extremely cumbersome. And many of us, not just bankers, but many of us from representing various constituents, had worked very hard on a bipartisan bill, both in the House and the Senate, that would allow loans of $150,000 and less to really just have a simple one-page attestation application for forgiveness. Now that would represent around 86% of all of the PPP loans in the country, and really would allow the small business borrowers to focus on running their business instead of filling out a lot of forms. Unfortunately, this was included in the stimulus bill that, as we all know, hit the wall last week. So we still hope Congress can get things together to fix this and allow the forgiveness process to operate as Congress intended. So Bill, I'll wrap up by thanking you again and look forward at some point in the future to visiting Hilton Head and stopping by and seeing you. Be happy to answer any questions.
Fred, we certainly look forward to that as well. And just to the numbers you provided are staggering, with the South Carolina banks closing $5.7 billion in PPP loans. And then the other staggering number is protecting more than 650,000 jobs for South Carolinians. And as we know, we're all concerned about jobs. And what you and your fellow bankers have done is terrific. And we thank you for that. We thank you for your leadership and also for being with us again today.
Thank you. Have a good day.
You do the same. Hope to see you soon, Fred.
I'm here.
All right. Our final speaker this morning is John Rembold. And John is the director of the Hilton Head Island Airport. John, certainly a challenging time running an airport and certainly in the tourism industry as well. But we look forward to hearing an update from you on what's going on at Hilton Head Island Airport.
Well, good morning, and thanks, Bill, for the opportunity. Can everybody hear me okay?
We sure do.
Excellent. Well, yeah, there's been a lot of great news, a lot of optimism in the call this morning, and I certainly appreciate that. And we do share that at the airport, too. I'm going to give you some stats so you can kind of understand where we are now and where we've been as an industry and locally at the airport since COVID started. The month of June nationwide saw air travel down 80% as compared to 2019. So that means that, we're doing 20% of the business across the nation that we did 1 year ago. So that's pretty staggering when you sit down and from a business standpoint and think about that. Depending on the day of the week, we're now industry-wide kind of hovering between 65 and 75% down over 2019. And that's a little bit of a victory when you bear in mind that at the beginning of the pandemic, the industry dipped by about 96 to 97% very quickly within a week or two. So it's been a recovery, a slow recovery. And indications are that it's going to be a multi-year recovery in the aviation air travel industry. But it is recovering, so that's a positive thing. Locally, we saw June numbers that were about 68% down year over year. But in July, they were only 48% down year over year. So we had a huge bump in July. It's great news. We did have American Airlines bring in some of their additional weekend flights, and those paid off because it definitely shows that folks are, number one, taking advantage of the opportunities to use their local airport to connect elsewhere to other places to go see family and friends. And also it affords the opportunity for our visitors to fly directly into the island, and be within a few minutes of their final destination, wherever that may be in the island or on the island or in Bluffton area. So we're happy to see that. General aviation has also been extremely strong this summer. They've had some great numbers that side of the airport. And I think that's another strong indicator that goes along with what we've heard this morning, that folks are eager to visit the island. It's a great market. And again, the island continues to perform very, very well. And people are trying to exercise any and all of their options to get here via air. So that's a good indicator. So things are moving in the right direction, but it's going to be a grind. And I can tell you that the tenant businesses on the airport are hurting as well. So when you think about the parking industry, the rental car industry, anybody else who works on the airport, they're definitely hurting. So if there's a way that you can support those businesses, through advertising, through patronizing those businesses, we certainly support that. And it's part of what we all hopefully can buy into as a shop local campaign. So we certainly encourage people to do that. Along those lines, with partnering with the Chamber and the VCB real closely, we have taken the pledge on the island. We've got the decals on the doors, so we hope that people will notice that and recognize the commitment that we've made to safety and really to try to improve to the extent that we can just the psychological aspect of people traveling, because we realize it's incredibly important for people to feel comfortable where they are and where they're going. So we make sure that we're putting our best foot forward there. And as far as the airlines go, all the airlines are requiring masks. And so that's gone well. We've had people acting in a very courteous manner in the airport, and it's been good. People are very friendly and helpful. And if they forget to put the mask on, people correct them. And I think people kind of police each other, and it's been received very well. So we certainly appreciate that. And people definitely get the message that masks are mandatory and on Hilton Head Island, and it's becoming a little bit of a habit, I think. So that's good. Of course, we always advise that there are. Yes, Bill.
I'm sorry. Go ahead. Sorry.
Okay. We always advise that folks check in with their airlines, and just for the latest updates, anything that they've got questions on, the airlines can answer those questions, because information does change on a daily basis sometimes. So that's important. I do want to update you on a couple of projects. The first one, if you've been by the airport in the last few days, last few weeks, you've seen the work on the entrance to the terminal side. That's now complete. So that sign's complete. We've got all the lighting and landscaping in. So if you've not been through there, come out and see it. Probably the highlight of that whole project, and we're really proud of this, is the fact that we've got the sculpture Humanus as part of the entrance to the airport now. So that the entrance was deemed a good civic environment for a sculpture, and we sponsored the exhibition last year that's held out at Honeyhorn, and we really appreciate the partnership there. But now everybody who comes in and out of the airport will get to see a piece of public art, and a piece of public art that was designed and put together by a local artist. So it's really cool to have Humanus out at the entrance. So come on in and check that out. And that's one of a great step, I think, in our overall project to just continue to improve the passenger experience at the local airport. So we're optimistic. We're kind of slugging it out day to day, but that's okay. We'll get there, and we appreciate everybody's support.
John, thank you. And that was where I was jumping in. We had a question about the projects taking place at the airport, and you certainly addressed that. That's exciting to see. I know there's been improvements to the airfield as well, and working on facilities and other things. So thank you for the update. Certainly encouraging numbers, and we're delighted to have the additional weekend flights back with American. And thank you for your partnership, John. Keep up the good work.
Thank you.
All right. Well, thank you all for joining our call today. We're delighted to have you with us again. Look forward to next week. And as we leave this call, let's remember to be kind, stay safe, and wear your mask. Thanks for joining us, and have a great rest of your week.